about compassion fatigue, I think about a concept that involves an individual feeling overwhelmed and exhausted due to caring for others, which is common in all helping fields.
There are probably a lot of definitions, but the way I think of it is, when you know you're sort of at your limit and that you need to titrate your exposure to certain things.
When I think about compassion fatigue, I really think about how much more can I take on? Because the work does involve really high stakes. And when someone comes to you when they need a protective order or when they need help getting out of a relationship, you sort of invite in all of those feelings, all of those emotions, and all of those problems, and you take them on, or it's easy to take them on as your own and really be the person who needs to try to solve those things. And so I think the fatigue comes in when you're limited in your ability to take on more.
Compassion fatigue for me is when I'm unable to leave it at work anymore. I have met with so many people who are in so many difficult situations and compromising situations that I'm finding it difficult to just go about my daily life and conduct my personal life without being concerned and without being worried about the folks that I work with over the course of the day and how they're doing. And, when it's Christmas or when there's a pandemic, just not being able to rest and their situations inserting themselves into what should be, the personal arena of my life. Mm-hmm. So it's, and, not being able to sleep and, not being able to eat and trying to figure out other people's issues when I should be taking time to take care of myself.
I think there are times when I become irritated, maybe, and I know that there's something going on, or when there's something that keeps repeating in my mind, or I keep visualizing the same experience that I've experienced with a patient. Maybe it's because my approach wasn't the right approach, and sometimes you always have to recheck your approach to patients. But I do think that when I feel that way, or I keep going back to that particular patient, that maybe there was something that I didn't quite do right, and I always feel like I can do a better job.
I think when it comes to my clients, I have in self-selection, I just have this capacity to hear, what they bring in. And sometimes it's really heavy and it's really deep. And while we're talking about it, I am right there. But somehow, and I care and I'm empathic and I'm really with my clients. But somehow I have the capacity then after the session's over to move on.
And so to me, I think it is, I think the way that I experience it is it's more of a question. It's definitely a calculation or a scale, depending on how much I think I can help someone versus how much I've got on my plate. So if I'm overwhelmed with cases where I feel like I just can't do that much for people, it's so easy to then, to say I don't want to take on more, and I think you start seeing that in your work, and you stop wanting, you start looking for reasons to not take on a case or not help someone. And that's really where you get limited in your ability to keep going.